Good afternoon and welcome to the AgrAbility webinar series. My name is Paul Jones. I'm the manager of the National AgrAbility Project, which is housed here at Purdue University. And today's topic is on mental and behavioral health resources for the drought aftermath. Our presenter today is Dr. Roberta Schweitzer. She has an extensive background in mental health issues and mental health nursing. And so we're very happy to have her as our presenter today. Before we get started with the actual presentation, I have just a few basic webinar instructions. If you registered for this webinar, you should have received a PDF handout of resources related to this topic. If you did not receive that, or you'd like other people to be able to have that handout, we will give you the link for that at the end of the presentation. You do need speakers or headphones to be able to hear the presentation, as we're not using a conference call line today. You might also want to check your connection speed under the meeting menu and the Manage My Settings submenu. Dial-up is not recommended for this webinar. We will also be taking questions about the actual presentation. If you'd like to ask a question, please type that in the chat window on the left side of your screen and hit the send icon. We will be collecting those and addressing them at the end. There is a captioning pod at the bottom of the screen. If you do not want to see the captions, you may adjust that so that those are not visible by using the menu that's at the top right of that pod. If you have any problems, technical issues during the webinar, please use the chat window, or you may email the address on your screen. You might want to write that down for future reference while it's available. I will note, during our last webinar we did have several instances of people being disconnected. We hope that does not happen today, but if it does, please just be patient and reconnect to the room. We have 4 quick survey questions at the end, immediately preceding our question and answer session. Those only take a minute or two, so if you'd please stick around and answer those for us, that will give us feedback on today's session. We are also recording this webinar, and it should be archived soon on the agrability.org link, or excuse me, agrability.org website under the online training link. For those that are not familiar with AgrAbility, it is a USDA-sponsored program, and our main focus is on disability in agriculture. Every AgrAbility project is a partnership between a land-grant university and at least one disability services organization. There are currently 23 funded AgrAbility projects covering 25 states, and the National AgrAbility Project is led by Purdue's Breaking New Ground Resource Center. If you'd like more information about AgrAbility and like to look at some of the other resources we have, including our Toolbox Assisted Technology database, please visit the agrability.org website. At this point, I'm going to turn it over to Dr. Schweitzer for the body of our presentation. Again, please feel free to type in your questions, and we will be addressing those at the end.
Hey, thank you very much, Paul. Thank you very much, Paul. I appreciate it. Again, I'm very honored and pleased to be part of this program. I myself grew up on a farm here in Indiana, a little farm, and I don't remember hearing a thing about stress or worrying about anything as a child myself, but I know there were lots of worries. They kept it from us, and so I admired them always for coping with everything well. But I think it's not any easier than it was then, and maybe harder, I don't know. So what I would like to share with you today is basically an overview of mental health concerns. We often talk about drought-stressed crops. Today I'm going to talk about drought-stressed farmers and families. So we don't want to forget that component of it as well. And you'll see an overview on the PowerPoint. We're going to basically look at mental health difficulties that you might run into, the main ones, stress some signs associated with stress and anxiety itself and depression so that you can recognize maybe a little bit of what's going on. Use appropriate responses. We'll learn a little bit about the basic things that you want to say or how you want to interact with someone, as well as some really key and wonderful resources that are available. And finally, a new opportunity, mental health first aid. We're engaging in a little bit here this last year and hope to share with you if you want programs. So, without moving further, let me get my slides to go here. Okay, so just to kind of generally look back and review as a whole, what is stress? And I know we all experience it every day, and I like this kind of a definition of a blocked chaotic energy, because it feels like that a lot of times. You're anxious, you're antsy, and not quite sure what to do with all that. Stress itself can occur different ways, and that's an important component. It can be very sudden. An example might be a tractor or combine that gets on fire or breaks down. You're in the middle of the harvest and you have timeline crunch with weather and so forth. So that might be an example of that. Or it can be a little bit longer, still a short time, but you might have one thing go wrong after another in a particular day, and just have one of those bad days. And that kind of can build up as well if you have several days like that. When you have weeks and months that go like that, it becomes to pile up even more. More and more stress is there. That energy is kind of free floating unless you figure out and know how you're going to handle it in a healthy way. And so what our goal is always to try and prevent that stress and anxiety from building before you can develop problems. So prevention and education are key. And what we would be doing is identifying the stressors, the things that are causing the problems, identify our signs and symptoms of stress, and then how to manage that. So I understand that the audience is mostly professionals and extension and some AgrAbility and other workplaces as such, and not so much farmers directly. So I'm going to mostly direct it to you as a support person for the farmers and rural folks that you work with. So, okay. Farming is indeed stressful, as I said when we reviewed stress. There's not a time when you're not trying to meet a deadline or get something in or planted or harvested or whatever. So, in fact, a very interesting study by the National Institute for Occupational Safety and Health actually puts farming in the top 10 stressful occupations in the United States. And that's not too distant of a study. Apparently it was done. This is in an 2008 journal, the reference to it. So it is there all the time. The problem is, of course, that the more stress you have, that is very difficult on your body and your physical being, as well as your emotional being. So it has kind of wide-ranging effects. It's interesting that farmers do have the same stresses as non-farm families, but that long list of cluttered on the slide there, you can see all the variety of normal, everyday kinds of stresses that farmers do have. That's just, season to season, day to day, week to week, things that are going on. You can see things to do with harvesting, things to do with finances, debt loads, machinery, passing the farm down. It's another thing to think about. Some of these farms have been in the families for 100 years or more, and who's going to be the one to break the chain, possibly. And if they don't want to and they're having difficulties, that is certainly a major kind of background stress. Overall, I think the biggest thing that gets mentioned is the unpredictability and lack of control. And I think that's very significant when you're trying to handle things, because things are unpredictable, can't always be controlled. And what happens if you're not controlling? Maybe you think you're a failure. That's a possibility. So that even adds more stress to day to day. Now, what happens then when there's a drought or some kind of a disaster, catastrophe that's going on? The difference is with the drought kind of situation, this is not just a day or a week or a month. It can go on for months and have an impact for years, a year or more after that, just based on what's happened. And I think we're in a situation like that now, as everybody knows. So while that drought is going on, then with the farmer and the family, the anxiety is building, like we talked about. The stress and the anxiety are growing, and it becomes more like a day-to-day increase that's going on, so that they may not even notice it at first. They're just coping, that flight or fight response, and it might pile up and pile up until you're stuck with a lot of intense feeling that's not dealt with. So oftentimes it's interesting. A tornado is something that comes through, a hurricane, and wipes an area out. You see it, you know it's very damaged. On the other hand, when you think about something like a drought, yeah, you see some dryness in the fields, but you don't really have the full impact of what that means because it unfolds in a much different, slower way. But the bottom line with this again is how out of control that feels and not to be able to do something about it. What I wanted to do today is put this in the context like you have a crop management plan where you go about planting and preparing the fields and monitoring them throughout the season and harvesting and so forth. Everything you deal with, the finances, that's kind of a crop management plan. And again, what we're going to put in place, hopefully, is a farmer management plan or a farm family management plan when it comes to stress and coping. And I don't know that many people think about it that way. Like I said, I'm sure our family didn't, but I think it might have helped. Just like we take care of our fields and crops and livestock and everything that we have in our farms, we need to take as much time as we can to take care of ourselves and our families. Because without that major resource, which is you, the farmer, who you're working with, the whole operation would not exist or maybe not quite as fulfilling as it is. The little model that I created is based on a Manitoba-funded, Canada-funded model that they use with some additions here. And they have, by the way, a lot of resources, funding into clinics that deal with rural mental health, and maybe some good model that we can learn from on how they do all that information. So the areas we're going to touch on are hit by the storm, the foggy middle, on firm ground, and calm in the storm, coping with stresses of life. And hopefully this can serve as kind of a way of thinking about the process that happens with a person and their stresses during a crisis like we're having. First stage is in the drought stress farmer model is hit by the storm. And as we said, there's already stress. So at this point, what happens is this extra stress lays on, and it keeps going and going like it has last spring and summer. At which point you realize this is not a normal year. Yeah, we have bad years, but this is a really bad year. And there will be major changes that happen as a result of that. And knowing that is a lot different than like next year will be better. So I think a lot of the feelings you see, disbelief, maybe even anger and rage at that. And again, what to do with it, you don't know. That sense of loss, you're going to have changes that might happen, loss of money possibly, very possibly, and that vulnerable feeling. And unfortunately what happens when people feel vulnerable, unless they have a nice set of coping skills that they've been taught or learned in their families, we often turn to things that are not very healthy to help us get through hard situations. Things like alcohol, drugs, that kind of thing, or behaviors that are not very healthy. So we want to be sure and work to correct that area. Early warning signs, that would be the first way you would do that, is instead of just going about your day and kind of ignoring it on your body level and your emotional level, is start paying attention to how you feel. And that's something you want to share with your family, farm families. They can help each other with that, the spouses as well as the kids even and the farmer. I'm assuming most of them are men, which they are. So when I say he, that's referring to either of them. These are things that you would start seeing, though, earlier on and would continue to intensify. And they could be in any area. It could be in the area of routines that they carry on around the farm, the declines that you see in their livestock and other smaller crops that are there, illnesses. You might start getting ill in different ways. We'll give you some more detail on that. Accidents, having silly little accidents that maybe you wouldn't have usually had because you might be preoccupied. The farmstead overhaul might start looking like you're not spending extra time doing the mowing and taking care of things and painting. And the kids can actually reflect it. Kids are amazing how they can be a barometer for a family, and they would pick up on stress as well. So those are things you might see. Here are some detail slides. I don't know that we'll read each one of them. If you have more questions later on any of these specifically, you're welcome to put them in, but you can see a variety of issues, and they fall into different categories. First category is physical, and I think that's pretty well documented down in the literature. You may have already heard this, but that when a person goes to their family doctor, usually 80% of those visits have something to do with an emotional issue or feeling. Doesn't mean they're mentally ill, but there's some emotional issues going on, whether it's stress and depression like we're talking about here today, or other things, but they reflect in your body. And so it's always good to think about that as a professional when you're with families, and they're saying they have headaches and ulcers, how you've been feeling about this whole situation. I've been really stressed lately. So being able to find those kind of things out can be really helpful. Another category is the emotional aspect, just the plain straightforward feelings. People may look more sad or more angry or more anxious than they usually do. Kind of lose your sense of humor. I know a lot of times my dad used to get together with a bunch of guys and they'd go have coffee, and after they bring props in and things, and they would always have a good time, laughing and so forth. So there may not be that much of that happening like usual, and that's certainly an indicator of the spirits being lower than usual. And the whole issue is to keep this going over a long time is what we're worried about. So you want to look for changes, increases in those areas. Behavioral changes as well. Some of these feed in with the feelings you're seeing expressed, or they can be, withdrawal, for example, is a really good one we haven't talked about much. Usually they might be a very social person, the farmer is, and go out and go to church and do events around town or whatever. They may just stay in bed and not go anywhere. And that certainly would be an indication and a change in behavior that you'd watch out for. Alcoholism and drugs, as I mentioned earlier, that's a really quick way to numb pain. Unfortunately, it doesn't work in the long haul, as we know, and has a lot of physical detriments behind it too. And violence. And of course, with alcohol often will come expression of feelings in ways that are not very healthy. So those are all potential. They certainly would not all come out. And I should say overall with this presentation, there's so much diversity in the human spirit that I'm sitting here making many generalizations, but hopefully you can get the high points of what's important when I'm looking at someone, or most like people that work in mental health, so that you can at least have something to, like a tip of an iceberg to hang on to. So these are again the behavioral issues. Cognitive, interesting, when somebody is very anxious and stressed, their ability to process and think slows down. And so they may have losing memory temporarily. Can't concentrate, can't, as I said, accidents might be happening, or making decisions about what to do with money, what to do with farm, what to do with day-to-day situations. And the biggest one I think of all is one that farmers and the farm families carry with them, is the whole idea that if they can't take care of their family and make things work perfectly, that there's something wrong with them, that they're a failure. And of course that is not true, we know, because you can't control everything. But self-esteem is a very kind of a tenacious thing that can make us feel really good, or if it's low, can make people very despairing. So very important when you hear words like this to keep that in mind. Okay. The next stage of the model, after they've realized they're in a drought or a situation like this, is the whole rest of the period of time when they're going through the middle of this. And again, it's not like clearly demarcated. It's not easy to know when the end will be, because there'll be ramifications, as we said, for a while after this. So this is kind of an empty, kind of chaotic stage that people will be in. Just like when the drought is happening with the crops, you don't know quite what's going to happen, how it's going to really end up. If there's going to be mold later, or what's going to happen. So it's kind of that really big uncertainty then. So they may feel like, oh, we'll get out of this one day, or the next, nothing feels like it's going to happen that's positive, really hopeless. So it's very uncomfortable to be in this stage. So this is also the time when they really might start questioning the farmer, do I really want to do this? Am I up to this? Am I capable of this? Is this, how my family feel about what I'm doing? We've had this farm for so long, and now I might lose it. So really important to, again, notice how it's affecting the person's self-esteem, and that's part of that. Now, the most common thing you're going to see from the stress is anxiety, which is that free-floating kind of feeling and tension. And along with that, the depression that comes with that can be very severe. There used to be a Freudian kind of an old saying that anger is, depression is anger turned inward. And in some cases, that's probably still true. I don't know that it's as seminal as it used to be, but oftentimes people will beat up on themselves, so to speak, metaphorically, when they're not doing as good as they think they are, and can cause depression. The other way it can happen is through acting out anger outwardly. And the third possibility is anger towards the self, where they literally consider hurting themselves, a suicide kind of intent. So those are probably the biggest things we're going to talk about today. This is, again, a very important time for assessing the farmer's emotional state. And again, it's over a period of time, so if somebody you're in contact with on a regular basis, that would just maybe be in the back of my mind all the time is, how are they doing? Have they changed for the worse or better? Or are they staying the same on how they're dealing with all this? The more you get signs and symptoms, the more severe they are, the more you should be concerned. And a actual mental illness is defined partially, in fact, by the way that they're not able to carry out their daily functions of life. So they're not doing their work, they're not doing their relationships and families well, they're just not able to function like they would normally function. So that's when you start being more concerned. If they have depression, and I've even talked about suicide in general terms, that's when in the back of your mind you're thinking, do I need to help them connect to some kind of a resource, a professional, some kind of person who can maybe help them? Now, they might not say this in so many words that they need help. In fact, many times I imagine this population would not say a lot directly, unless they know you're really interested and really care and want to hear that. So part of it we'll talk about later is how you approach someone to get that information. And if someone does say something about wanting to hurt themselves, or they're so depressed their life doesn't seem worthwhile, you don't take that as a cry wolf story. That should be taken very seriously. It is something that you, again, you don't know quite what to do with when you hear, but the fact that you're hearing it means that they're at least trusting you to tell you that. So that's a very positive sign, rather than keeping it to themselves. And then we have several lists here of signs and symptoms of depression. Again, that seems to be the more global kind of a situation you might see in people. Again, it shows up in all the ways we've talked about in general: their appearance, their feelings, their thoughts, the pleasure they're taking in their life, their people problems, being able to relate to each other, the physical illnesses, and this guilt. The difference here becomes, as I said, where it's really taking a toll on their ability to function on a day-to-day basis. So there are little checklists, which we'll talk about on the reference sheet, where you can literally sit down with somebody or let them do it, fill it out, and see how they're faring in this, or you can do it and get a sense of what you think might be going on with them even. So really important to keep tabs of those symptoms and markers along the way. The other thing I want to specifically talk about is when the depression is so bad that their suicide is contemplated. And I should say before we start that the majority of people do not commit suicide when they have depression, but it's so important that even if one person is considering that, we need to pay attention to it. Most people with some support can get through a depression quite nicely and move forward. So we're not talking a long-term stigma, hopefully, with this. But if there is suicide kind of ideation going on, that's where you can really come in very, very supportively for the person. It's a kind of a desperation response. How I think of it is sometimes when someone is in a place that's very difficult, everything looks dark. And I've actually done sessions with people in my therapy where people don't see a light at the end of the tunnel, literally. They think that they're buried in the dark and will not ever be able to get out of this. And that is the key to suicide, is it feels like there's no way out. So the fact that you might be concerned and be there to listen and talk to them is very, very extremely important. So it is a desperation kind of response. Again, you may see a lot of these very same issues going on. We have a theme here. There's nothing really new about the way it shows up, but just the severity is increasing, whether it's the hopelessness, the alcohol or drug abuse use. Other thing that's in here that's important is, have they had a family history of any kind of suicide ideation or depression? And have they had any attempts with suicide in the past? So, and do they have a plan? That's another very important question. The more people have thought things through and worked them out, how they might end their life, the more likely that will happen. That's kind of a general rule. And so that's important to think about too. Some of these symptoms, if they find out they're having them. Okay, this is a handy little guide that I found in a piece of literature somewhere a while back, but it's Is Path Warm? It's a mnemonic, which is, if you look at each of the first letters, obviously, of the words, it spells Is Path Warm? And that can be something just to keep in the back of your mind. Ideation meaning, are they talking about suicide? Are they talking about hurting themselves or ending their life? Is there substance abuse? As I said, that's kind of escalates everything when that's present. Are they feeling purposeless without any meaning in their life? Is there that anxiety, that energy that's going on that doesn't have any place to go? Do they feel trapped? Do they feel hopeless? The withdrawal we talked about, going off by themselves, sleeping all day, anger. Recklessness is an interesting one. Often people will take less care with their own health by maybe not putting seat belts on, not driving as carefully as they would usually, accidents that might not be really accidents at some point. If you were to look back on there, those occur occasionally. And then mood changes. Are they really happy one day, really sad the next? That can be another kind of diagnosis as well. So that's just a list that you can kind of keep with you on a card even to go through those and get some input. Okay, so now we come probably to the part that's most important to you, which is, so yes, I'm finding some of those signs, finding some of those symptoms. What do I do? I'm not a trained professional. I never had classes in doing psychotherapy. Actually, the biggest things you can do are probably the things that take the least training, are things that you come with innately, which is caring about people, especially if you're your neighbors or they're in your community. Worrying about what to say is less important than what to do with them and how to be with them. So what to say, anything that's supportive in a general way, not everything's going to be fine, don't worry, because that's not really necessarily true. But something that might be true is you don't have to handle this alone. You have your family, you have friends, I'll support you as much as I can, and we can find you some additional support that's professionally trained. So that kind of information is what you want to get across. Again, working with the hopelessness, that there is a way out of this, we just got to find it together, do some problem solving. And then along with that would come the really praising or reinforcing the fact that they're sharing with you. That's a very hard thing to do, not something everybody loves to sit down and talk about their weaknesses and failings. And so that just means that maybe they've trusted you enough to let you in on what's going on in their life. The other thing you would do is, if there is an imminent kind of a danger for life, you would definitely contact resources right away. Just as in the CPR, if somebody's having a heart attack and you're doing CPR and it's not going well, you would call for an ambulance. You don't wait. So the same with the emotional health, equally. Okay, let's kind of stop with suicide a minute here. I know it's not all about suicide, but again, this is the most difficult thing for people, and I think that's why I put more time into it, because it's kind of uncomfortable and frightening in many ways. Quite a bit of the literature over periods of years in the 80s, the 90s, 2000 era have found in research studies that farmers have higher rates of suicide. Now, I wouldn't have expected that necessarily. Myself, I was kind of taken aback by that. But when you start thinking about it and reading about it more, what group less shares their feelings of inadequacy and down and not feeling well and feeling low and bad? Usually you push forward, at least in my family you did. Push forward, you don't complain, you don't talk about the down days. You just go out there and get to work and do your job. However, it's interesting that instead of what we think accounts for a lot of this is, instead of doing that talking, they will hold it inside, all that energy and all that stress, till it builds to a point where they don't see a way out anywhere, and they just complete the suicide. So it's again that feeling trapped and lost and not connected to anybody that can help them. So that's in a way a very simple thing, but a hard thing too. So, but knowing that, I think is very encouraging for me or any of us to be able to reach out to somebody who's suffering with this. The big thing to think about too is suicide is preventable, and things will never ever stay always the same. They are not. Life is changing, and so you can always count on those two things when you're talking to people. Again, the key is they want to live, or they wouldn't be talking to you or even around you, but they can't see the way out by themselves. So that's very positive for intervening. Also, you hear about people give warning signs. Sometimes they will do, and you might not think of them that way. Again, that's not because you're not paying attention or not very clued in, but sometimes people are more subtle. And that's a study I would love to do someday, is look at how farmers express these kinds of emotions, and is there a difference in the general male population. So, but often there might be. If you hear something you think is a clue, I'd address it. So, the other myth I want to talk about here, the myth I want to talk about for a minute, is that if you talk to someone about suicide or ask them, that will cause them to commit suicide. And that is absolutely not true. It's the opposite. As I said, maybe you're the first one that's had the courage to even bring up the possibility, because you know that person and you know that's not how they usually are, so that you want to be able to touch base with them in a way that maybe others wouldn't be able to. And that just will build the trust that much more with you. You don't have to do it in a rude way, but we'll talk about that in a second, but there are ways to get that out. Okay, again, you as a staff person or a professional out in the community, the biggest thing again is that building that connection and active listening. I was talking about all the fancy tools. There's not really too much fancy about that. What you would do is be with someone and be not doing other things. So if someone is distressed, that's especially important. Actually, that's probably harder for us because we're uncomfortable. We want to do something. We want to help fix them and make everything right because we care about the person. But that's probably not what's needed right then, because they wouldn't be able to even take it in at that point. In this case, listening is not very passive. It's a very active thing you do. It takes time, takes focus and energy. So instead of every time they have a problem, bring up a suggestion, you're going to just reflect back to them or let them know you're listening by nodding or whatever. Empathic kinds of responses, they call those, where you show you care. You might even say something like, if they're talking about how they're feeling, so you feel like this, you feel like things are not going to get any better. It's basically kind of repeating back something they said, only letting them know you're hearing exactly what they said. So you can do that again with words, with nods, with just how your demeanor is with the person. The only way that really makes it tricky sometimes is if you do things that what they call are communication busters. And again, I think this would only come out of your own concern and anxiety. For me, that's what happens if I'm talking to somebody and I'm not sure what to do. You might interrupt them or kind of be thinking about, oh, I got to leave in 20 minutes and look at your watch, or judging them. You know, if you were worth your salt, you wouldn't be feeling like this. You should know better than this. Get yourself together, that kind of thing. And sometimes they're really obvious and sometimes they're more subtle. But I'm kind of doing overboard now, I think. Stating opinions is fact, and that has to do with things like religion. You may have certain feelings from your religion about suicide as well, but this is not the time to share those probably. You're more concerned right now about the person and making sure that they have the support they need. That's also true of these things in depression in general, not just for suicide. These are things that make us all kind of feel like we're not being heard or worth enough. And if somebody's self-esteem is already low, that would certainly maybe compound that more. Okay, with farm families, so you've talked to maybe the farmer, There's also something to be said for connecting with the family as well. You might get a different perspective or the same perspective. You might find out that the wife and the kids are as depressed as the husband is or not, or kind of struggle with it herself, say, for instance, the wife. So you would look for some cues as well with them and kind of find out how are things going in the last few weeks. You know, it's been hard, I know, for everybody. And then there's another example of what you might say is, this has been really stressful. And a key thing to somehow insert is that this is a normal reaction. This is not crazy or mentally ill. It's normal because this is a very abnormal event we're experiencing, not something we go through every day. And so it would be expected that you would be upset about it. And that's okay. And so the key then is to say, follow that with, you know, maybe we can help you figure out some ways to deal with this, some insight into it, some problem solving and whatever, but letting them know that there is something that can be done. It's not the end. It doesn't have to be the end. So whether they're just depressed, I shouldn't say it that way, whether there is depression or if there is suicidal ideation or intent and they've admitted that in some way, what you would want to do then in the back of your mind is thinking about, how can I get them to someone that can help them more than I can? And that's has to be couched, I think, in a certain way with these kind of folks that live in a kind of independent, self-sufficient way, very resilient in general speaking. And so this would be kind of done with the person. You would let them know that, you know, you're not capable, this is not your area of what you know about the best to help them, but there are people that you can go to. And even if it's a local minister, pastor at a church, we have some other ideas coming up here a little bit too, but anybody they trust, their family doctor is always a good place. The hospitals, there are many places that you really don't think about usually unless you really need them in a crisis. So we might want to, part of our plan later on might be to look up some of those resources now so you have them the next time around or next time there's a problem. So if someone does call a crisis line, if you decide that that needs to be done and there's nobody else available right then, you might be there with them or not, depending on what they would want. And just to maybe let them know kind of this is where the person is at, quote unquote. If they shy away from doing talking, then you know you can be supportive with them and helping them do that too. So, as I mentioned, there are resources, and that's I want to spend a little bit of the time now. We've kind of done the highlights of the basics, you know, finding out if there is a problem, looking at how bad the problem might be, looking at do they need an instant referral for something life-threatening, or is there time when you can deal with it in a period of days or weeks with a depression of some sort maybe. Excuse me, a drink of water. As I mentioned in the example I gave you, crisis counseling is a really valuable thing. In bigger towns and cities, there may be a center, crisis center. That's wonderful, if there is. If it's in the area where you live, that's often better because they know the environment, they know what people are facing, and so that makes it more friendly for them to talk. If there aren't live people, there are crisis lines that you can call. In fact, on our resource list, you'll find there are all over the country various crisis lines, and if you don't live in Nebraska and there's one there, I think it would be fine if you call Nebraska. It wouldn't be like you couldn't call them. So whenever there's a crisis, you call you need, and other places that we'll talk about. There may also be in the local hospital. Like I know in Indiana, the Indiana University healthcare system has satellite hospitals all over the state, and they often will have a person that's in the office and the ER that is trained to take calls like this and then get them connected with the resources and do an assessment. So that would be a definite kind of a positive. Usually a social worker in a hospital as well, a nurse specialist or a advanced practice nurse. Local docs we talked about earlier, and clergy, very important. And local mental health counselors. If you look in the yellow pages when we get done, you might find that there are several counselors. Excuse me. Need a drink of water here. There are counselors that Oh dear. My voice is good usually, so just a moment. I'm having a small crisis. Not too big though. Okay, it's coming back. Local mental health counselors have private practices, and that's another thing to look for in the yellow pages as well. In addition to this, not right in the middle of a crisis, but some of these resources are good at later times. Another drink of water. You can find information about different diseases or illnesses, understand better what they are. Legislation, you can find out what legislation is going on that deals with mental health. You know, we have the new Mental Health Parity Act now in the last couple of years, and hopefully insurances will cover that. Unfortunately, not every farmer has insurance. That's a problem, but at least it's a little more amenable to getting some kind of care. There are also two very important organizations that you can call for crisis as well as for information, and they're advocates for people who have mental illness or many mental health issues, and that would be Mental Health America, MHA, or National Alliance on Mental Illness, NIMH. Each of these organizations are nationwide, and they all have chapters, either regional or statewide or citywide if it's a big city. So that's a very important resource for mental health help and support. They offer classes, brochures. They also have web-based online check sheets where you can see, am I depressed? Am I anxious? Am I, whatever the illness might be? Am I bipolar? Just to name a couple of them. But it really helps to kind of feel for what's going on with you as a person or the family itself. Of course, AgrAbility is loaded with resources, as we mentioned earlier. If you take a second and just look at your handout, you'll see these are drawn from several different sources, which is good because it kind of cross weaves and is very comprehensive. So you see some very common rural helplines that are on the first page, all excellent, run by counselors and psychologists and people who have worked in this area for many years and very respected. So that's a real safe place to call. Things to specifically deal with drought from SAMHSA, you'll see down below. Treatment locators, places where you can actually find where would I go for treatment. NAMI we mentioned. Then each state, there's an article that was in the April 2011 issue of Journal of Agro-Medicine that goes through all the resources in the AgrAbility projects, and that can be very helpful too. It talks about what states have what resources, and you might be able to even share across state lines and use different information to help one another, brochures and things like that. So if you just page through this, you'll see the screenings, the stress management, so how you learn new skills, there's a lot of that in here too. There's some videos, all kinds of information. So if you have any questions about that during the question period, that might be something to bring up too. Okay, moving along. Another stage, we're getting kind of the end of the stages, but this one is, as you're going through it, don't forget to remember your neighbors. And that stands for the idea that, you know, rural communities kind of have survived and carried on because they do reach out for each other. They don't stand alone, they work with their neighbors and help people get things done. And that's the same thing, I think, in this case with a drought-stressed farm family, is that they need to know that other people are out there with them and going through the same thing. So don't cut off your isolation and isolate yourself. Use their families and resources. Get together, get together and have a cup of coffee or a potluck and be able to share things together. And you might even want to take a list of resources we have that are local, just to let them know what's available. Okay, the final stage then would be calm in the storm, coping with stresses. This is the time, once the severity is gone, since we're already into this one, it would be a time when you kind of get back together and anchor yourself with your family, your friends, your community, and learn some new skills. And that's really important for the future. And I'll talk a minute more about that. But don't forget the caregiver. You are identified, most of you, as caregivers in this case, because you're professionals who work with those out in rural areas. So you hear stories, you hear all these events going on. It's important to not let yourself feel overwhelmed and frustrated, but be able to hear their pain but not take it home with you. So you need to take care of yourself, which means physically, emotionally, all the things we talked about, nutrition, sleep, activity, everything to make sure that you are taken care of before you can help others. It's kind of like putting the oxygen mask on yourself before you pass it to your kids. So I think that's a good example of that. One program that's really helpful with this that we've found here in the last couple of years is called Mental Health First Aid. And I put just a few of their slides on here. I was really excited to be able to attend the training last year and be certified as a trainer for this. And you can see it's sponsored by Maryland and Missouri, the two states have come together. This program actually came, well, first of all, what the program is. It's help provided to a person developing a mental health problem or experiencing a crisis until professional treatment is received or the crisis is resolved. So just a situation like we have now. And it's for non-professionals. They don't want psychiatrists necessarily to be trained. They don't want, they can of course go to the class, but people who know counselors, social workers, but it's really a helpful course. I took it myself, and it's 2 days usually, 2 6-hour days, 12 hours of training with lots of examples of mental health problems you run into, how you talk to people, what you do first, second, third. It's very helpful. So it started in Australia, interestingly enough, in 2001 in the rural areas, out in the Aboriginal areas and so forth, where there's less care. And it was started by a psychologist and the nurse wife, who's his wife, and they put this together and wanted something that would be quickly available and not intimidating, and this is definitely it. So you can see they've gone all over the world, and finally they started here in the United States. And their research to date for those 12 years or so shows the following in their publications, that what this program does, because they're really doing good evaluation, is increase people's knowledge and understanding and literacy, so to speak, about mental health, expands their help, helps them to know what to do in a situation of crisis, helps them to connect those people to a service, and really importantly, reduce the stigma. So the more you understand what might be happening in somebody's mind, the more you're able to appreciate and be with them. So what their goal is for first aid and mental health to be as common as CPR in about 15 years so that it's available for everyone. You can see there's a broad range of people. This is not limited, but these are certainly people that would benefit from it. Lay people, whole communities are being trained. I've worked with nurses to date, staff in a local rural hospital, churches, any kind of folks can benefit from this. And if you want more information on this program, there's a website you can look at, mentalhealthfirstaid.org. I also, since I am trained as a trainer, would be happy to talk to you about training in your area. We could help look for maybe trainers that are already there. If there aren't any,
Thank you, Roberta, for that presentation. Some very helpful information. If you have questions, please, again, type those into the chat room, and we will be addressing those in just a minute. We would also like you to complete the 4 poll questions, so I will bring the first one up for you. And it simply asks about your professional affiliation. If you could just indicate what type of organization you work with. We'll go ahead and give you a second to fill that out. Okay, appreciate your input on that. I'll be closing it here in just a second. We realize some of you may be in multiple categories, but appreciate you just indicating the best choice there. Our second poll has to do with the information that was shared today. If you could please let us know how you felt about the information as to whether it met your expectations and whether you believed it was valuable or not. I'll give you a second to fill that out, and we will broadcast the results here in just a minute. Okay, thank you very much for your input on that. Third question asks about the technology that was used today. And we're wanting to know whether you believed that the technology was effective and usable. And specifically, if you did have some problems with getting disconnected from the room, or if you had some specific suggestions about the technology, we'd appreciate you sharing those in the chat window so that we can follow up on those specifically. Just to give you a few more seconds to indicate your choice on that, and we will broadcast the results. Okay, thank you for your input on that. And we do appreciate you letting us know if you were disconnected from the room. Final question asks about your belief about attending another session in this series based on today's session. Based on today's session, would you attend another session in this series? Just a couple more seconds and we will broadcast those results. Okay, thank you for your input on that. This time I will turn things back over to Dr. Schweitzer, and she will be addressing any questions that were submitted in the chat window.
Okay, I think I'm back. Okay,